Hey guys, I want to talk to you today about inflammation and non-steroidal anti-inflammatory drugs, your ibuprofens, your Aleve, your Advils, and how those things can actually, believe it or not, most people don't know this, but they can actually cause a heart attack. It can cause you to have strokes and heart attacks. Not only that, ulcers, other things. And I didn't just come up with this. This is actually, I like the word actually today apparently. This is right here. This is the Mayo Clinic website, and the question on here says, does taking non-steroidal anti-inflammatory drugs increase my risk of a heart attack or stroke? And what did they say? I don't know if you can see that right there. It says yes. That's their answer, yes. They can. It will. Okay, so I'm going to talk to you about why that is and what the percentages are of your risk of that, and more importantly, what do you need to do instead to reduce inflammation, because I think we can all agree that inflammation is a big deal, right? Hey, just to introduce this as well, this is, again, I'm Dr. Kyle Lovelace, and this is Shift Your Thinking, Shift Your Health, and really giving you a different perspective and viewpoint on health. Instead of doing what we've always done, going to our doctor, getting a medication, having a symptom, going to the medicine cabinet, actually asking better questions so we can get better answers and saying, hey, what is it that actually is happening in my body? When I have back pain or neck pain or headaches or digestive issues or whatever my problem or symptom is, why? The question you want to ask is why, not how can I get rid of it. Ask why first, and then we can start to move into how can you get rid of it. And that's the shift your thinking part. When we shift your thinking, your health will follow. So non-steroidal anti-inflammatory drugs and inflammation is our focus today. Now let's talk about inflammation. Inflammation is something that is a normal immune response. It's something that our body has to have to be healthy. It's a great example of this, and I think everybody can relate, is when you tear a muscle, or let's say you sprain an ankle, and that ankle swells up and becomes inflamed. That is inflammation at its root, at its easiest form. You can see it happen, and that's your immune system sending cells, white blood cells and different immune response cells to that area to start to heal up the tissue. It's a protective mechanism. It's also a healing part of your health. It's very, very important, and we never want to stop that process. Okay, let me just say that again. I have no reason to want to stop inflammation. Inflammation is your body responding to a foreign object. It could be a virus coming in. It could be some just random protein from your food. Maybe your body didn't digest food properly and you have food allergies. That's an inflammation response. Hey, maybe it's you breathe something in like pollen and your body doesn't like it and wants to inflame your sinuses to get rid of that. That's our normal innate immune response, and we want to take good care of it. We want to keep it strong and healthy. However, in our world we live in today, we have we have gotten to a state where we're chronically inflamed. And the reason that's happening is because we're constantly having these things that our body's trying to attack. And that could be because of maybe we got vaccines when we were younger and they put aluminum in that vaccine and it created this constant antibody response. That's actually what happens. It creates an constant antibody response. You get antibodies in maybe your thyroid or in other areas of your body, and your body starts attacking itself, and it's an autoimmune disease, an inflammatory response. It could be that every day you're eating sugar, and it's a constant inflammatory response happening in your body. Maybe you have food allergies and it's a constant inflammatory response. The point is that I don't want to get rid of the inflammation. I want to get rid of why your body's creating constant inflammation. Okay, let me just say that again. The medical approach right now is you're inflamed, let's get rid of it. My backstory is I used to have something called irritable bowel syndrome, which is an inflammatory bowel issue. It's where your digestive system becomes inflamed. The answer for that, or ulcerative colitis, or any inflammatory digestive issue, is a steroid or an anti-inflammatory. The problem is they're never getting to the why did I have inflammation in my digestive system in the first place. They're simply giving you a drug that will block your immune response so that you no longer have inflammation in that area. However, you are now blocking your immune response. And if you know anything about health, you know that your immune response is an essential part of your body not getting cancer. It's an essential part of you fighting off a virus or a bacteria. It's an essential part of just everyday life and us being able to handle our environment. So we never want to reduce our body's ability to respond to our environment, which is our immune response. Hopefully that makes sense. So non-steroidal anti-inflammatory drugs at the core, they're COX-1 inhibitors. It's a process in our body where it inhibits a pathway. And you've heard me say this before, any medication you take will either inhibit or excite a pathway. Okay? So if you're inhibiting a pathway, it's going to affect other pathways in your body. So we're inhibiting this COX-1 pathway, producing something called prostaglandins. In return, the idea is it's going to reduce the inflammation in the area. Okay? That sounds good, except for that COX-1 pathway is also very important in protecting your stomach. It's also very important in other aspects of your health, and that COX-1 pathway isn't just in that area, it's all over the body. So in return, you're going to have what they call side effects, but they're really just effects, normal effects that would happen if you took a medication. So we get the inflammation down, but the problem is now you get ulcers, or we get the inflammation down and the problem is now you have a heart attack. I said that non-steroidal anti-inflammatory drugs, according to the Mayo Clinic, can cause heart attacks. So let me just read the rest of that. They said yes, but then they said NSAIDs, medications commonly used to treat pain and inflammation, can increase the risk of a heart attack or stroke. It's important to take only the dose you need for as short amount of time as possible to limit the risk of a heart attack or stroke. Taking NSAIDs once in a while or for a short time, such as to help with pain due to injury, generally has only a small risk. So let's be clear, when you take ibuprofen, there is generally a small risk if you do it every so often. Here's the problem. Most of the patients that I see coming in here that are in pain, that are taking ibuprofen, they're not doing it every so often. They're doing 8 a day at a minimum, right? They're taking whatever the minimal amount they can take is, sometimes more than that. And so it's never usually just a little bit. And for that person, it's like, it's just okay, it's every so often. Listen to this. The study that showed that it increases your risk of a heart attack said that you have within the month that you take an ibuprofen, or an NSAID, I'm not just kidding on ibuprofen, leave Advil, any of those. Within the month that you take it, your chance of a heart attack goes up by 40%. So think about that. Think of all the people you know that have had heart attacks. Did their heart attack possibly happen because they took an ibuprofen a week ago? Did they take an NSAID a week ago? I don't know. But according to that study, it says that it can, and according to this, from the Mayo Clinic, it is important to take only the dose you need. Who comes up with that? Right? Like, think about that for a second. Who came up with the dose you need? And are every one of us the same? Some people weigh 100 pounds, some people weigh 150 pounds, some people weigh 300 pounds. Some people are males, some people are females, some people are African, some people are American, some people are Asian, some people. So the point is that every one of us is different. We have different genetics, we have different background. And the truth is that there is no perfect dose across the board. But when you go to Walgreens or you get a non-steroidal anti-inflammatory, what's the dose? Across the board. And so the point is that there is no needed dose, because you don't know what you need, and your doctor doesn't know what you need because it's an educated guess. It's an opinion. In other words, it's an opinion on how much is okay for you to take. So here's my opinion. My opinion is that you should never take it. Okay? Now, if you're in severe pain, severe pain, an ibuprofen is not going to help anyways, right? So don't take it. If you're in severe pain, like you can't handle this pain, go get pain meds, right? If it's that bad. I'm not going to tell you not to do that. If I had, got a car accident or cut my arm off and it's throbbing, I'm going to probably take whatever they need to give me to get rid of pain. I'm not going to live on that. I'm going to try my best to get off of it. But my point is that the non-steroidal anti-inflammatory drugs, we're really taking those in areas where we could probably handle it, and we could probably handle that for a while until we actually figured out the cause. So your first thing when you have a symptom is, why do I have that symptom? So if I have back pain or neck pain or headaches or digestive problems, anything like that, I'm going to say, okay, why is that there? And then I'm going to start to go and evaluate to find out why it's there and how to get rid of it. And so I'm going to go to a doctor that's going to have a philosophy or a way of looking at things that is trying to figure out why I have the problem. Going to your medical doctor and saying I have headaches and them writing you a script is not figuring out why you have a problem. Now, going to a chiropractor and saying, why do you have headaches? And then they take x-rays and then they do a spinal evaluation, and then they figure out, okay, your headaches are coming from your spine, your back pain is coming from your spine not moving properly, and they start adjusting you and your back pain goes away. Well, now we figured out why, we got rid of the cause, and we did nothing but help you or have it with zero side effects, except for you might feel good or your muscles might be a little bit sore after the adjustment. Other than that, now your body is actually back to functioning and healing again. That's one approach, and that's the philosophy that we have in this clinic at Queen City Health Center, and hopefully every chiropractor across the country thinks that way. Or you have the other approach, which is, hey, I'm just going to take this medication until the pain goes away, and I'm going to do that on a daily basis, and hopefully my problem will get better. But the truth is, it's actually going to get worse, and you're putting yourself at risk of a stroke, of a heart attack, of ulcers. And you can say, okay, well, I take Tylenol. That's not an NSAID. Okay, cool. Well, Tylenol is the second leading cause of the leading cause of non-alcoholic fatty liver disease. So right now in our Charlotte, I just found out that in Charlotte, the third leading cause of death is heart disease. In the country, I believe it's the number one. It's right there with cancer. The number one cause of death in our country is heart disease. The number one reason people go to a doctor right now, one or two top reasons people go to a doctor, is for back pain. What do most people take for back pain? NSAIDs. So we live in a world right now where NSAIDs are like candy and people keep them in their purse and they're living on them. We also have the highest rates of heart disease ever. Those things are correlated. And so one simple thing you can do, right? No, you don't want to get rid of sugar, you don't want to get rid of food preservatives, and you don't want to eat healthy or exercise or move, don't take the NSAIDs. That's one simple thing right there. So that's my whole take on it, guys. I think that you can, that makes a lot of sense. It's backed by the research, right? It's also backed by one of the leading medical hospitals in the world, the Mayo Clinic. And so everything you can do to stay away from the non-steroidal anti-inflammatories and actually find the root cause. Go to a chiropractor. The number one thing you can do for back pain or any kind of pain at all is to find out what the cause is. Go to a doctor that's going to evaluate your spine and actually give you care that's going to get you better. The reason I say go to a chiropractor is if you go to a medical doctor, you're going to get a medication for that. And that's not going to help you. Cool? All right. Hey, guys, like this, love it, and share it. You guys have an awesome day, and we'll talk to you next time.